If you're in the United States or Canada and wondering how to become a yoga therapist, not just someone who teaches yoga, but someone truly prepared to work one-on-one with complex physical and mental health conditions, chronic pain, anxiety, autoimmune conditions, long-standing trauma, structural imbalances, then this video will walk you through the professional pathway here in North America. We'll talk about what yoga therapy actually is, what yoga therapy certification means in the US and Canada, what professional training requires, what a yoga therapist career can realistically look like, and how to know if this path is right for you. If you're researching how to become a certified yoga therapist, this is the pathway that applies to you. Because becoming a yoga therapist is not about accumulating hours, it's about developing clinical discernment. What is a yoga therapist? A yoga therapist is trained to work one-on-one using yoga-based tools within a therapeutic framework. That includes assessment, pattern recognition, nervous system regulation, breath and energetic awareness, progressive session planning. This is not group class teaching, it's individualized therapeutic work, and that requires a different level of preparation.
Your foundation in yoga therapy. For most people, the first step toward becoming a yoga therapist is completing a 200-hour yoga teacher training. That provides a base in teaching, anatomy, and philosophy. And from there, you move into professional yoga therapy training. In the US and Canada, serious yoga therapy training is typically multi-year and designed to prepare students for the therapeutic one-on-one work and professional recognition. If you plan to pursue IAYT certification, that's certification through the International Association of Yoga Therapists, there are specific educational standards your training must meet. But what matters more than the number of hours is how those hours are structured.
Many yoga therapy trainings will teach you philosophy, they'll teach you techniques, they'll teach sequencing and elements of Ayurveda. And of course, all of this matters, but individual tools alone do not create competence. What creates competence is structure. And that's why we developed the BDYT clinical method. It's a 3-pillar framework that organizes how to think clinically. The first pillar is holistic pattern assessment, learning to recognize patterns across physical, emotional, and energetic layers, not just symptoms. The second pillar is skillful and attuned therapeutic design, designing sessions progressively based on real assessment, not guesswork. And pillar 3 is ongoing guided clinical practice, because confidence doesn't come from lectures or hours. It comes from supervised, experienced, and real client work. This is what allows a yoga therapist to feel calm when complexity walks into the room. And this structure matters because it affects real outcomes with real people. Across all condition types worked with in our supervised practicum, physical, mental health, and complex multi-layered cases, we've tracked an 86% positive outcome. That means the majority of clients seen within our supervised training model demonstrate measurable improvement. And that didn't happen from inspiration alone. It happens from structured assessment, thoughtful therapeutic design, and guided clinical refinement.
And what's just as important is what happens to the student. Students consistently report feeling more organized, more confident, more clinically grounded by the end of just foundation certification, not just knowledgeable, prepared.
So if this resonates, where do you begin? At Breathing Deeply Yoga Therapy, the starting point is our Foundations program. Foundations is where students learn how to assess holistically, how to think clinically, how to structure one-on-one sessions, and how to understand physical, emotional, and energetic layers in an organized way. It's not just more information, it's a shift in perception. It builds the lens through which you see clients. Foundations is appropriate whether you're a newer yoga teacher, an experienced teacher wanting more structure, a mental health professional integrating somatic work, a healthcare provider expanding your scope, or you're interested in transitioning into a new career. Foundations builds the framework, And our advanced program deepens specialization, has more supervised practice, and prepares students for full professional eligibility. But it begins with foundations.
So, what does a yoga therapist career look like? It looks like in the US and Canada specifically, it can look different depending on your background. But we see our graduates work in private practice, in integrative clinics, in mental health settings, in physical therapy collaboration, trauma-informed work and programs, and online therapeutic work. Some build full-time practices, and some integrate yoga therapy into existing professions like counseling, nursing, or bodywork. What determines success is not personality or intuition, it's preparation.
So is this path right for you? You may be right for this path if you feel limited by your group classes, you want to work more deeply one-on-one with people, you care about both mental and physical health, you want a structured, ethical, therapeutic model, and you want to feel prepared and not like you're improvising. Yoga therapy is not about performance, it's about responsibility. And that requires training that's organized, supervised, and clinically grounded. If you're serious about becoming a certified yoga therapist in the US or Canada, the next step isn't just reading a page, it's getting clarity. We've created a short pathway assessment below. It'll help you determine whether yoga therapy is right for you, what stage you're currently at, and what training path makes the most sense for you.
And if you already know that you want a structured clinical approach, you can also watch our in-depth training overview, which explains the IAYT clinical method in detail.
Both links are below. If this work is calling you, then that's the next step.
Thanks for watching.